Hi, I'm Kayla Roman, and I'll be highlighting top professionals providing senior financial services. Today we are meeting with Kevin. Hi, Kevin.
Hey, Kayla, how's it going?
It's good. How's it hanging for you?
Oh, great.
Good. Do you want to start off by just telling me a little bit about yourself, whatever you feel comfortable sharing, maybe what you do on the weekends, hobbies?
Yeah, sure. I've been a Medicare insurance specialist for almost 10 years now, and I lived in the Philly area, right in Fishtown, for 10 years as well. Hobby-wise, I like doing a lot of outdoor things like hiking, playing soccer, tennis, swimming, stuff like that. Yeah, I'm an animal lover. I got 3 cats currently, but I've pretty much had every type of pet you can imagine.
I grew up on a farm, so we had lots of different pets as well.
Oh, wow. That's cool. Nice.
Yeah. Do you want to share with me just kind of like how you got into insurance in general?
Yeah, sure. I was job shadowing a friend back in 2014 who was involved with the same type of business. Following job shadowing him around, I knew that it was a career I wanted to be involved with, but also that the senior population was also a population that I liked working with, and that really deserved a lot of help with all kinds of things.
So what made you want to get into the senior financial market specifically?
Dealing with insurance and senior financial matters, I just connect and resonate with the senior population a lot. And a lot might not be as tech savvy as some younger folks. And it's just, for me, it's I get a lot more passion of helping that population and with insurance matters.
Do you think, Kevin, you could share what some of the biggest challenges that you see your clients facing regarding their financial situation?
Yeah, the biggest challenges are the cost of living goes up every year, especially in the past couple of years with inflation going up so high. And then, with the cost of rent and, utilities, groceries, while Social Security is, pretty stagnant, only goes up a little bit every few years. It's just so unaffordable for the average senior to afford, their basic necessities, and then also to afford healthcare, paying co-pays for the doctor, co-pays for prescriptions, paying medical bills. So, most people are living paycheck to paycheck, and it's not getting any easier for them.
What are some of the goals that you're able to help your clients attain?
My goals are to get them on the best health coverage possible, the most affordable coverage, most affordable life insurance coverage, making sure they're able to see all the doctors they want to, afford their prescriptions, and getting the quality of healthcare they deserve, most importantly. And then as an agent, I like to be on top of answering, returning people's calls, answering any questions they have, and making sure they're caught up to date every year, with all the changes to Medicare and their health plans.
What is a big concern that you see in the next 3 to 5 years for the senior financial market that you think that your clients are going to be facing?
Piggybacking on what I said before, cost of living is extremely high. Cost of healthcare is extremely high. Getting access to, the right care and basic necessities and maintaining good quality of life is going to be, out of reach for, the general senior population. So that is definitely my biggest concern. And then, with today's political climate, the environmental climate, it's hard to predict what's going to happen, but it looks like, people are losing access to a lot of benefits that, should be available to them.
Without divulging any specific details, can you tell me about a client at a time where you helped them solve something that was like really important to them and that really made an impact on you?
Sure. I have a client of mine I've had for years now. She's in her 90s, and she is a polio survivor, and she's, wheelchair bound. And the first time I met with her, she had no medical coverage except for Medicare, no prescription drug coverage. She could barely afford her rent. And meanwhile, she was eligible for Medicaid. She was, in such a low income that she could barely afford anything. Even groceries for her were really difficult to pay for. So when I met with her, I helped her apply for Medicaid. I got her on a great health insurance program. I helped her find a new apartment that, had much higher quality conditions than where she was living. And she's in much better shape now than, when I first met with her. And I always make sure she gets the highest quality of care.
That's great. Okay, well, thank you so much, Kevin, for meeting with me and telling me a little bit about yourself and sharing a little bit about what you do and how you help seniors in this financial market.
Mm-hmm. Yeah, it's been such a pleasure, Kayla.
All right, take care.
You as well. Thanks.
All right, bye.